Well, this new federal budget does have a strong focus on healthcare funding. Joining us from Ottawa this morning with reaction is the president of the Canadian Medical Association, Dr. Alika Lafontaine. Welcome back.
Good morning.
The budget includes this $198.3 billion. That's to be invested in healthcare over the next 10 years. We talked a little bit about this yesterday. Is this enough?
So one of the things that often happens in budgets is people are looking for surprises that come through. And I'll tell you, as an anesthesiologist who's managed crises over the last many years, the most important thing in a crisis is predictability. And so I think Canadians should be happy about what's been put aside in this budget. We've had about a month to consume what's going to kind of move forward. There are two things that are really exciting about the way that healthcare funding is moving forward in this round. The first is that there are some strings attached related to sharing of data and also moving forward mobility of healthcare workers across the country, making sure that we can go to the places where patients need us. The second is that it's actually focused on the right kinds of shared priorities. You know, a lot of the things that we've been advocating for as a CMA and also with our partners across the country is the very things that ended up in this budget. And so we're pretty satisfied, and I think as we look to the months and years going ahead, this will be good for Canadians.
I love focusing in on the positive, but when you were watching yesterday, is there anything you felt should have been in there that wasn't?
You know, there was one item which was related to the administrative burden. You know, there was a report published not too long ago that there's millions of hours looking at a study in Nova Scotia that could be better used to administer patient time. You know, unlocking the ability of healthcare providers across the country to do more with the time that they have available and not spending it on paperwork is going to be one of our focuses now that we're, you know, in the place that we are at and moving into the next budget cycle. But you know, there is a lot into this budget that's going to start to move us forward. And like anything in healthcare, things are complex. And so we have to take a stepwise approach and make sure that we address things completely as we move forward.
We know that there's been coordination between provinces before working to improve wait times for healthcare, for example. But what is the necessary follow through on collaboration like this? Some of those strings attached you were talking about.
You know, sometimes what we do in healthcare is we talk about the situation, and then once we get the funding in place, we all kind of get up from the table and move on to try and solve things our own way. And so the federal government has done a really great job of bringing people around the table. And it's really important that we remain sitting there until we actually solve these problems. And that's one of the issues that happened with the Wait Times Alliance. We were making some progress, and then people got up and left the table. And so moving forward, that follow through is going to be central to make sure that we actually fix the problems and we solve the major issue of Canadians in the country, which is getting access to healthcare.
Let's talk about that. Patients desperately want to see improved access to healthcare. I mean, just even at the family doctor level, you call your family doctor, you can't get in. They tell you to go to the wait clinic. You go to the walk-in clinic, they tell you they can't take you. You go to the ER. You go to the ER and they're looking at you saying this isn't an emergency. You feel like you're a nuisance at every portal that you go to. Does this kind of funding improve that for clients?
So, you know, if it does transform the interaction of patients and providers at the point that they receive care, absolutely. And so how are we going to do that? We're going to focus on things like family health teams, which is a priority of this budget. We're going to focus on making sure that we fund backlogs and you know, the well-being of health workers, which is also a part of this budget. And so I think that we are focusing on the right shared priorities. You probably have noticed that since all of this was announced about a month back, provinces across the country are making investments in healthcare. You know, this is an investment year, and I think the investments have a great potential of going to the right places. And once again, we're all around the table, so it's about time that we get these problems solved.
Everybody's around the table, and now they're forced to stay there. Dr. Lafontaine, thanks so much this morning.
Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.